Hi, welcome to At Home with Madeleine Lee. This is the second part of my ME series. Now, I hear so many different stories about doctors and I've got my own. I've just had 3 very interesting visits to the doctors here in France. And the first doctor, he was so old-fashioned, and he basically said to me, "You're just depressed and it's in your mind." And as anyone knows, when you feel like this, it's not in your mind. Even though we are going to discuss later that it helps how you think with your mind, but it's not in your mind. So I came away feeling really despondent. He was actually very patronising and told me that I was lucky to have a husband that would look after me, and that if I could just think differently, then I would be well. I've had 30 years of therapy, I've done so much, and I feel so peaceful in my mind and in my heart after all this. So I thank M.E for that, but I'm still feeling ill. So it's got to be something that's physically happening to my body. It isn't just in my mind. So I came away from there feeling really upset, because there's a little part in you that starts doubting yourself, and then when you start doubting yourself, then you get angry with yourself, and then of course that's when you really need to be careful how you think. So it's a bit of a spiral. Now, the second doctor I went to, she was British and she believed in ME. Now, it was almost like it was quite boring that I came to her with ME, because there's nothing we can do about it. Take an antidepressant. What more can I say? You know, if you need to take some extra vitamins, there's nothing we can do. Well, I came away feeling that she wasn't the right doctor for me. And actually, I did speak to her a little bit later and I said, "Is there any way we can do some more tests? Because I just keep having the same old blood test. Is there something else?" Well, we could do. And then when my B12 comes back all right and just all the normal run-of-the-mill blood tests, then no, sorry, there's nothing we can do for ME. Okay, so then I try another doctor. Now, she's French, young, seems really lovely. So we sit in the surgery and I'm telling her my symptoms. And then she turns around to my husband and said, "I think it's in her personality." I wanted to bop her over the head. That's so upsetting when people say things like that to you. And again, I came away feeling so despondent. In England, I had a fantastic doctor. She was amazing and she was so gentle and she so believed. But still saying that, there still isn't anything. There are tools to help, but there still isn't an answer. And I think that's what's so difficult for us and for people that don't have ME to understand, because they don't get it. And again, because I spoke in the last one, it's not normal fatigue. So I just wanted to share that with you. On a positive note, there are 2 practitioners that have helped me a lot over the years. Sarah Myhill's very good. She specialises in ME and she'll be able to tell you what to take and diets to use. So she's very good for that. So she's a very highly recommended one, Sarah Myhill. And then often thyroid is very associated with ME as well. I've had thyroid problems for years and been taking medication. And Barry Peatfield is very good as well, so he can help you on that side of things. Both of them will do blood tests and that can help you out. So they're the people in my experience that could really help you, so I recommend contacting them. And as I said, we'll continue this on my next YouTube in a few weeks when I talk about my diet too.